Dear friends, I am Dr. P.P. Bose. I am the Senior Consultant Pulmonologist, the founder of SARS Foundation, and many of you must be following me in my blogs and websites. And I keep updating you on different areas. And today, I must tell you something very interesting. The Omicron virus has been a huge experience for all of us. The reason being, when the initial Omicron virus came, we thought probably it is going to threaten us with another kind of epidemic, but it turned out to be a boon because most of this Omicron virus will be mild to moderate. And in fact, none of my patients had dropped their vaccinations. So Omicron, as I mentioned in my previous video, it's a vaccine virus. So all my friends and my colleagues and my patients who have this kind of symptoms in the form of cough and cold, a little feverish, they are blessed in the sense that this virus is basically acts as a vaccine virus for you, and it's a boon, and you are triply protected. If you're already been vaccinated against COVID, so this little Omicron, which is a self-limiting disease, acts as a third vaccine. And in fact, even most of the organizations also saying that you not to get panicky about the third vaccine because this is acting as a vaccine virus. But one very important thing I must tell you today, my dear colleagues and friends and my patients, this is a very unusual winter climate. The temperature is very fluctuating, extremes of temperature coupled with downpour, and winter is a weather known for high level of pollutants coming very low, what we call the winter sucks, and the summer the pollution goes up. This is a very sucking weather. The suspended particles, they're very high in this kind of cold weather, and those who are little vulnerable, people those who are suffering from chronic lung disease, especially chronic obstructive pulmonary disease, chronic persistent asthmatics, allergic rhinosinusitis, they should be a little careful. Because this high particulate pollution in the form of virus, in the form of different kind of suspended particles, in the form of aerosols and all, they can trigger your chronic respiratory disease. So my dear friends, I'm really not worried about the Omicron hitting you hard, but I'm more worried about your asthma or COPD or your chronic allergic diseases can get little haywire if you don't get treated adequately. So please, those who have been suffering from chronic lung disease in the form of these diseases which I mentioned, the COPD, asthma, or any kind of allergic diseases, please go to your experts, adjust the doses, take the regular preventive doses. And if you have a lot of allergic issues, use nasal sprays, adjust your chronic airway control by regular breathing monitoring at home, what you call breathometer monitoring. And if you are not on preventers, please continue to take your inhaler preventers and controlling drugs. They are very important. Also, those who have been on regular inhalers, it's very important that they should be taking their other vaccinations. Not only the COVID vaccination, the flu vaccination is very important. Pneumonia vaccination is very important because you have to get protected from every angle. So, friends, it's not the question of Omicron decade, it's a question of respirable particles. The respirable particles in all form, right from particulate pollutions to the virus, they can be little risky for people, those who have chronic lung diseases. Please take your inhalers in right dosage, adjust the inhalers if you are feeling symptoms in the form of cough and cold and wheeze and breathlessness and night awakening. And please visit your pulmonologist to adjust the dose. And don't forget to take your due annual vaccinations. Regards, Dr. Bose.